Welcome back to ventricular pressure volume loops and the cardiac cycle. The pressure volume loops in the cardiac cycle is an inclusive change within the heart from the initiation of one heartbeat to the next. One heartbeat involves a contraction systole and a relaxation diastole of the heart chambers. When a chamber of the heart contracts, the chamber is in systole. When a chamber of the heart relaxes, the chamber is in diastole. The pressure increases during contraction and decreases during relaxation. These alternating pressure changes are responsible for two physiological processes: the movement of blood in a unidirectional way and the opening and closing of the valves to ensure that blood is moving in one direction. We'll start off with the ventricular pressure volume loops. The first phase is also known as isovolumetric contraction. This goes from 1 to 2. This is the point where there is the end diastolic volume of roughly about 140 mLs of blood. The ventricle is activated, it gets contracted, and ventricular pressure shoots up. All the valves are closed, and there's no movement of blood at this particular time. So the ventricular volume between both sides are constant. You can see right here that the movement of blood goes from 1 to 2. The pressure goes up on the ventricular side. Volume is the same because you're getting ready to contract. Isovolumetric means no change in volume. Then steps 2 to 3 is where you see ventricular ejection. That is going to be when the left ventricular pressure becomes higher than the aortic pressure that then pushes open the aortic semilunar valve. The blood is then rapidly ejected and ventricular volume decreases, and the volume remaining in the ventricles at 0.3 is roughly about 70 mLs, which is going to be our end systolic volume, ESV. Then isovolumetric relaxation occurs from step number 3 to 4. This is when the systole contraction ends and the ventricle begins to relax. Ventricular pressure drops down below the aortic pressure, so now the aortic valves begin to close, and as we said, the ESV of 70 mLs is inside the ventricles. Going from step 4 to 1, this is the ventricular filling. As the ventricular pressure has dropped below the atrial pressure, this then opens up the the mitral valve, and now the left ventricle fills up with blood from the left atria passively. At this phase, the ventricular muscle is relaxed. So you can see right here that goes from 4 back to 1, and the cycle repeats itself again. Let's compare this with the cardiac cycle. First phase in the cardiac cycle is isovolumetric contraction, and this is going to be where the Purkinje fibers initiate the ventricular excitation. Ventricles contract, pressure rises, AV valves are pushed closed, and also the semilunar valves are also pushed closed. Immediately after the atrias move the blood down, the ventricles begin to contract due to innervation from the AV node bundle of His Purkinje fibers. This isovolumetric contraction is the first stage of ventricular systole in which the ventricles contract and squeeze on the EDV. Step number 2 is ventricular ejection. Ventricular ejection is what follows, and as the pressure in the ventricles builds up to greater than the arterial vessels, it opens up the semilunar valves. Blood is pushed into the pulmonary trunk on the right ventricle and into the aorta from the left ventricle. And since blood is being ejected from the heart, this is referred to as ejection contraction. Isovolumetric relaxation is the early ventricular diastole, and it begins when the ventriculars begin to relax. There's no change in blood volume, and during this time, the pressure in the ventricles becomes less than the pressure in the greater arterial vessels, and therefore the semilunar valves and the atrioventricular valves close. The fourth phase is also known as atrial contraction with ventricular filling. This can be the first phase or the last phase in the cardiac cycle. This is initiated by the innervation of the SA node, in which the blood is squeezed into the relaxed ventricles. Most of the blood entering ventricles from the atria has occurred without atrial contraction. The AV valves are open and the semilunar valves are closed. The amount of blood inside the ventricles after this happens is called EDV. So the ventricles are filled with what we call end diastolic volume. It might be easier to follow along with the picture. So over here is a visual showing you the steps. Isovolumetric contraction. As you can see right here, the blood is filled up inside. There's no movement, equal amount of blood on the left and right side. All the valves are closed. Ventricular ejection, where the pressure builds up greater in the ventricles, so it pushes open the valves, and now able to move on the right side to the lungs and the left side to the body. Isovolumetric relaxation, as you can see, blood comes back in, fills into the chambers of the atrias, and now you have ESV, the end systolic volume, left over inside the ventricle chamber. And then we go into ventricular filling / atrial relaxation, atrial contraction, where the atria is squeezed, moving blood down, it begins to fill up, and the cycle repeats back to isovolumetric contraction again. So what are some changes in the ventricular pressure volume loop? What are some things that can affect this curve? First of all, when you increase the preload on the ventricular cycle, recall that preload is equal to EDV. When you increase the venous return, the EDV will also increase, right? More blood coming into the heart means you have more blood inside the heart. If after load and contractility remains constant, that means the outcome will be the stroke volume will increase. So increasing preload increases stroke volume. When you increase the afterload or increasing the aortic pressure, what does that mean? That means you have to have a much higher pressure during the isovolumetric contraction to move the blood out. As a result, the ESV will increase. The amount of blood left over after the contraction will be increased. So increasing afterload is going to decrease your stroke volume. Increasing contractility will cause the ventricles to eject a larger volume of blood because there's more overlap and more calcium ions. This will then decrease your ESV, and therefore the outcome is to increase your stroke volume. So increasing contractility, increasing stroke volume.